awesome to be here and to be in front of you and to be on this part of this incredible panel. I'm going to start with this statement. I believe that medicine, the practice of medicine, is a creative act, and that medical training and medical education must be expanded to include a role for artists, for designers, for writers, and for humanities scholars. Why do I say that? I am an emergency physician. I've been an ER doc for 20 years. I'm also a writer. And over the course of my career, I've been leaning more and more on my writing skills as essential clinical skills in the care of my patients, to allow me to sort of gain traction in their stories, to make sense of stories that are oftentimes incredibly complex and profound. Despite the fact that we try to prove otherwise and convince ourselves otherwise, ambiguity and uncertainty is the ambient reality of medicine, right? And we focus so much on knowledge, right? We focus on knowledge, and we talk about data at this meeting, and we're talking about evidence-based and these big treasure troves of knowledge. But the truth of the matter is that all this information that I have in my device cannot help me with what sometimes is the most critical dimension of what I do, which is learning how to ask the right questions, right? And that requires a different type of expertise, and that paradoxically is an expertise in not knowing and comfort and uncertainty, right? So I believe, another I believe statement is that we must expand the role of physicians as science-using, evidence-based practitioners to also include doctors as makers and artists. Doctors as makers and artists. Because though we're in this world of guidelines and evidence-based recommendations, you can't forget one fundamental fact, which is that medicine is not a script, and patients are all different. I am not a designer. I don't even play one on TV. But luckily, I'm very fortunate to be able to interact and collaborate with designers and artists and creatives of all stripes at Brown, at Alpert Medical School, at Brown University, at Rhode Island School of Design, RISD, and the RISD Museum, with dancers and dance and choreographers at this organization called Artists and Scientists as Partners in Providence, and numerous others. And what they've been able to do, and we've been able to work together on, is to create these spaces where students can then understand and play with essential aspects of creativity. You know, can they become comfortable with uncertainty and ambiguity? Can they make connections between disparate ideas? Can they think non-linearly? And can they become more intimate with their own vulnerabilities? So in 2010, we had this experimental course that actually put RISD students and Alpert medical students together in the same class to see how each group sees, interprets, and responds to the world and makes sense of the world. And they actually worked on projects together. One of the students who actually happened was an undergrad at the time, Kevin Louis, during his medical school training, actually created this series of workshops that's mandatory over the course of a year called Integrated Clinical Arts, where we have artists and creatives of all stripes running these workshops for students. And many of these artists are actually patients themselves. And in this space, you know, students were able to make connections between the practice of art and the practice of medicine. We also have, of course, and that's been going on since 2011. For the last 4 years, we have Design in Health, which is a course that is entirely student-driven. It is a collaboration between the medical students and RISD students. And was started by a medical student named Ravi Sarpatwari, an architect before medical school, who is fortunately now is an intern in my department. And again, they're looking at systems issues and design issues, and they're collaborating with faculty, not just at Brown, but at Rhode Island School of Design and with local partners. So I think, I don't think I'd have to tell anybody in this room that medicine is a mess. And we're facing constant challenges, and it's not just having the knowledge, but we have to think about the problems that we're all confronting very differently. And I think we need different people who have different perspectives and different tools, and those include artists and designers and humanities scholars. I cannot do this alone. In fact, all I am is a connector, and I have been very blessed to have worked with a tremendous amount of really amazing, talented people, all of whom should probably be up here on the stage. And I think ultimately, we think about design and systems, and we think about design and devices. I also think that we can't forget about design and the doctor-patient interaction and how we make decisions. And through it all, we can't forget that there's a beating heart at the center of what we all do. Thank you very much.